So according to what I read, we have a number of interns that are yet, found it. There we go. This is that press statement I made reference to earlier from KMPDU. And they say KMPDU signed and registered the 2017 to 2021 collective bargaining agreement following a very protracted and painful 100-day strike. I remember this strike. I remember President Uhuru Kenyatta akiwafokea, akiwaambia kuna pesa ya magari na mortgage, but we'll get into that. However, the MOH, county governments and parastatals have abandoned the implementation of the CBA, ignoring basic salary adjustments, creation of call rooms. You could perhaps tell us what call rooms are and why. What's a room, like what's in a room, and then posting of medical interns, to the point that 1,000 interns have stayed at home for more than a year, awaiting posting, employment, and provision of working tools and constant consultations that would make industrial harmony possible. So who are these interns?
Okay. So when you graduate med school, you do your final exam, then you're on the pass list and you graduate, and the next step is for you to go for your internship year. You're posted ideally by the government, and it's the government that compensates you for that year. So there is not a specific guideline on the duration of time it should take. So I get people telling me they finished medical school about 8 months ago. They're still waiting to be posted. It's a very uncertain time, and I believe that's one of the reasons why we need a health service commission to be able to streamline some of these issues. So you've graduated, you're supposed to be posted. You cannot do anything because you can't do anything because they might just say in the next 2 weeks you'll be posted. So it's a really long period of uncertainty where you're just hoping and waiting blindly that they're gonna post you. That's what KMPDU was fighting about, that there should be like a guideline on how to post these interns. Yeah.
All right. So, how big a problem is burnout? Because if we're talking about a shortage of, sorry, I forgot, call rooms. What are call rooms?
Okay. So when you go to your internship here, I don't think you guys realize, but interns are like the backbone of the public health system in this country. When you are doing your internship, you're the one who, let's say, quote unquote, runs the show. The consultants and the medical officers just are there to peek and see are you doing the correct thing. But you're the one who probably is admitting, depending on the facility that you're in, you're the one who's admitting these patients. You're the one who's seeing them when you're, let's say you admit them at night when you're on call. Being on call means, how will I describe this? You are the one who is responsible for anything that will come up that night. You're on duty for that period. So let's say I'm on call tonight, I'm on duty tonight, yeah? So I will admit the patients who will come in, and I will see them again tomorrow morning. Then I will present their cases to the medical officer who's supervising me, or the consultant, if there's a consultant who's available that day. I'm the one who is their primary caregiver, should I say that? Like, I'm the one who's in charge of their care directly. I'm the primary point of contact. Should there be anything that I'm not able to handle, that's when I probably consult the medical officer or I consult the consultant. So when you're on call, you're at the hospital, let's say at night, and you need a place to probably put your head down for a few hours. Should you get the time to even put your head down for a few hours? So typically this is how it works. Let me use Monday as an example. So we're going to work on Monday as usual, yeah? Then I'm on call on Monday night, yeah? So I'll be at work from Monday 8 a.m. to 5 p.m. Then my call will start at 5 p.m. and it will last till the next morning on Tuesday at 8 a.m. And I will still continue working from 8 a.m. to 5 p.m. You're so bewildered. Exactly.
All right. Okay, at least now I have a sense of what a call room is.
So the call room will be there available for you to use at night. Should you get some time to put your head down, but should anything come up, they're going to keep calling you to go see the patient you need to see or do whatever you need to do. There are some people who never get a chance to put their head down, and they have to be up for the 36 hours that I've described. So definitely you're going to burn out. And depending on how many you are in that internship center, it determines how many times are you going to be on call per week. Let's say you're there are rotations, yeah? So probably I'm rotating in surgery, and in surgery we only have 2 interns. I'll be on call every other day. If I'm on call today, my colleague is on call tomorrow, I'm on call the other day. So that's the situation on the ground. I feel like people do not know anything about how the medical system actually works. But if you have to have conversations with people on the ground, you would be shocked at how much it's glorified, yet the effort that people are putting in on the ground, it's insane. Yeah.